Hi everyone, my name's Catherine. I'm the founder of Heart Mind Heal, and the aim of my work is to help people understand their bodies more and improve their well-being by coaching them to connect with their bodies more deeply through massage and movement. Now, the reason why I'm producing this presentation is actually as a result of my own personal journey in my first mammogram testing, and microcalcification has been detected, and I'm currently waiting for a biopsy to get that confirmed as to what it is. Now, I'm putting this together because as I remember when I first got called back by the doctor, it was quite worrying, understandably. And she just said, I have microcalcifications detected. Now, first of all, I did not know what that is. And she didn't have a lot of time to explain to me, which I totally understand. And she just said, they can't confirm exactly what it is. The only way to find out is with a biopsy, which requires a 3-night hospital stay and surgery. Now, it was a lot going on. It was like me, I had this life happening. I was trying to build my life and had a lot of projects going on. And this was like a sudden stop, a combination of, oh, this could be the sea, and I've got to stay 3 nights at hospital. And it could be nothing. And how much, and I have to pay for the hospital stay. It can be quite costly. So it was like, oh, well, I can't make the decision now. And I had to come away and do more research about it. And so, which is what I have done. So whilst waiting for the biopsy, I am waiting, I'm doing my own research. It helps to give me a peace of mind about what this could be using different people's experiences, both client and medical professionals' perspective. Now, by all means, I'm not a medical professional and I do not give medical advice. This is only research and information obtained, and I'm using that information to analyze it to make sense for myself. And I'm offering this as a way to encourage people to do their own research, and because it is your own body and we have to be responsible for ourselves, and the only way to do that is to do learning and learning more, do more research, because when you have some information is better than none, and having some information helps to give you some peace of mind. So this is why I'm putting together my research and findings into my report and what that could mean, so that I can come away and live my life as normally as possible. But if there are any professionals out there that would want to offer their advice or opinion or corrections even, please, I'm all ears. And do apologies if the people watching this can only speak Mandarin. I have not found a resource that I can use safely, cheaply, and effectively into translating this into the language. But if there are anyone out there that can do that, that'd be really helpful as well. So let's move on with this presentation. It's called Basic Understanding of Mammogram Results. So the content of this presentation would include what the screening process involves. So there are 4 different types of screening stages as we move along the detection from the mammogram into the biopsy. And then we're going to talk about what is microcalcifications, some of the basic terminology that I come across in my report as well as my research, and reading different mammogram imagery. So again, I'm not professional. These are only what I found online, which I found really useful, and is reference only. And then I'm going to show you a picture of my scan and compare that to the information obtained from the reading imagery research. And then we're going to go back into the report interpretation of the wording on my report, and then my assessment at the end. And bear in mind, there's a list of references that I have used during this research. So for anybody who's interested in knowing more where this information comes from, it is all at the end of the slide. Right, so we're going to talk about the screening process. So the first line of screening is called a mammogram. So it's a low dose X-ray examination of the breast tissue, and it is used by healthcare providers all over the world to detect early signs of breast cancer before they become worse. Now it's divided into 2D and 3D. So 2D mammogram is basically viewing the breast from top and the side, hence the word 2D. And then you have 3D, where they use about 15 images across the arc of the breast. And that gives you more of a better view around the breast, so hence the word 3D. Now, that's probably more useful for those who may have larger breasts, and people want to be certain as well. But that's, I think, provided on a self-pay basis, because it's a more advanced version. And then if something such as dense tissue or abnormalities or inconclusive results being detected on the mammogram, then we'll move to the next stage of the screening process, which is on the slide here. So here we go. So first is the mammogram, and then the next step would be ultrasound. I've actually had ultrasound done following the mammogram that came back negative. So that is pretty good news so far. And then the next advanced screening would be the MRI or CEM, which stands for Contrast Enhanced Mammogram. So here's a sample of the pictures shown on the imaging, and it's definitely more advanced, and it gives you a more high definition of the breast tissue that really goes deep into what's actually there. Now, I know that in Taiwan, I think NTU, National Taiwan University Hospital, offer this, but it is a self-pay. I think it's around 21,000 NTD, but you need to have a 2D and a 3D mammogram as well. So that could be quite costly, but it could be a non-invasive method for those who prefer not to go through with biopsy. However, if something were found at MRI, they will have to do the biopsy anyway. So biopsy is the last resort, and it gives you a proper diagnosis of what the calcifications are. But the good news here is that approximately 80% of the biopsy comes back as negative, which is a good news. So it sounds pretty good so far for my situation, but this is a really useful tool to give women more information about how the process works when it comes to screening. Okay, the next slide. What is microcalcifications? So it is the build-up of calcium salts within the breast tissue, and it can come up as white specks or flecks on the mammogram. So you can see here's an example of a calcification found on a mammogram. And the good news, the majority of them are benign. And how do they happen? So it can happen as a result of any previous injury, inflammation or infection from illnesses, fibrocystic changes. So that refers to hormonal changes, which is more prevalent in menopause or perimenopause. Aging breast tissue. So if you become older, they can happen as well. And then any previous surgeries or biopsies done. Now, the concern about microcalcifications is that a small percentage of them are associated with DCIS. So DCIS stands for ductal carcinoma in situ. So it's a medical term to confirm that it is a non-invasive breast cancer, early non-invasive breast cancer. However, it can be invasive, but is less common. And it is shown or identified by how it appears on the mammogram by pattern, shapes, location, and appearance. Okay, next one, we're talking about the basic terminology that I have come across in my report, and these are quite prevalent, especially if further tests are to be done. So the first one is benign. So benign means non-cancerous. So if you see the word benign, it's good. And then you have malignant, which is cancerous. So obviously that's not so good if you see that. And then you have macrocalcification. So calcification has been classified into macro, which is big, and then micro, which is small. So macro, they are large round calcium deposits, and they are usually linked to age or any previous trauma to the breast. And they're always, almost always benign. So macro calcification is actually okay. Now micro, which is small, there were like tiny specks of white spot we saw. It does require further monitoring because some formations can indicate early cancer. And then you have lesions. A lesion is a medical term to point out an area that requires closer inspection. And then you have BIRADS. So BIRADS stands for Breast Imaging Reporting and Data System. So this is the international standard scale that goes from 0 to 6 and tells you the overall level of concern from the imagery and what are the recommendations next. And there is an example of BIRADS category here, which I find really useful. So here we go, 0 to 6. So here we are, 0 to 3 is seen as benign. So any category that from 0 to 3 is non-cancerous. And then 4 falls into the suspicious category that requires further tests. And then 5 and 6 are malignant, which is cancerous. And you can see here the estimated risk of cancer. So 5 and 6 about 95 and 100. Category 6 is 100%. Now I've been classified at 4A, which is more than 2% but less than 10% of risk. And you can see biopsy is recommended. So for those who are not sure of the wording, this is a really useful slide. So please do take a screenshot of it for your reference. And let's move on to the types of lesions. So this is basically a word that described by radiologists as an area to be further reviewed. And they can be anything there can be anything else as well as calcifications, such as cysts, fibroadenomas. So these are like the lumps of connective tissue, but they are normally non-cancerous. And you have scar tissue that can happen as a result of surgery and infections from illnesses or inflammation. And then you've got malignant tumours, which is cancerous tumours. Okay, next one we're going to talk about imagery. Now this is from Radiology Assistant, which is a really good resource that really taught me a lot about reading my own imagery. Now, what do they look for when it comes to reading the mammogram? So they're looking for presence of a new mass, a grouping of calcifications, any asymmetry, architectural distortions, skin thickening, nipple changes, any lymph node enlargement or more. So let me just move this across. So this is an example of what a normal imagery looks like on the breast tissue. And here is irregular mass. So you can see they normally compare that with a previous imagery to the current one. So here is the old one, the old mass, and then that is the new one. So there has been changes since the last one done. So that's something to be further looked into. And then you've got architectural distortions. Now, architectural distortions, I have done my notes. It says pulled, puckered, or straight. Lines radiate outwards from a central point. This is a bit technical. As you can see on imagery, they are pretty much the same. But again, I'm not going to go into too much detail here. It's just for information only. And then you have microcalcifications here. So here's another cluster. And then breast density. So you can see the changes that can happen from there to there. So you can see this is more of a smoother line and this is like more jagged. So there are some changes there. So this is something that the radiologist will look for. And some of these descriptors, they can be benign or malignant. Okay, next slide. Cool. Okay, reading imagery. So some of the descriptors they have put into different categories. So first of all, calcification morphology. So morphology is a term that refers to the specific shape, size and physical appearance of the deposit. So morphology is basically the descriptions that's been used to term what they look like, and that have been given a number of descriptors here, such as skin, vascular, popcorn, fat necrosis, microcalcifications, dystrophic. So then they've kind of been divided into benign, concern, or malignant. So in a malignant session, one word popped up is pleomorphic. So pleomorphic means many shaped. And then the amorphous. Sorry, I don't know how to say this word, but I'm just doing the best as I can. It says without a clear shape. And then you've got heterogeneous, which is diverse, mixed, or uneven. Now, I've got heterogeneous on my report, heterogeneous dense breast tissue, and it falls under the intermediate concern category, which kind of marries up with the BIRADS category 4A confirmation descriptors of the results. And you have the benign group would be the dystrophic, which is large, irregular. So going back to the macrocalcifications that we saw earlier. And then you have suture, which is calcium deposits that happens from surgery, from surgical stitches. Cool. Right, so the next part we'll be looking at is the actual different types of formation that could be benign, malignant, or intermediate. So in the benign group, if it's a diffuse or regional calcification, they will be seen as non-cancerous. And then here you got cluster, which is a smaller grouping, and that's being classified as intermediate concern. And then you have linear and a segmental. This would normally be seen as cancerous. And so it's interesting they said that regional or segmental is problematic. So regional is benign and segmental is malignant, because it's not sure where the boundaries would be when it comes to segment. So you can see here they are quite similar in characteristics in that they are spread out. Here is more because they have more patterns, but here regional, they don't have as much of a pattern. But if you think they are, they'll probably be, if they are malignant, then they over time they can actually turn into this. So I guess if we see this at the beginning, I'll say, well, no, that's nothing to worry about. However, they can grow into this. So I guess that's why they would say it's very hard to confirm whether these are whether a certain regional would be definitely be benign. And then you have linear here. So linear, it says, is typically seen when DCIS fills the entire duct, the milk duct, and it branches with calcification. So DCIS, remember, is the formal term for early non-invasive cancer, and this can happen, that's their formation as they start to spread along the milk duct. Cool. Right, the next one, this is my scan. So here on my scan, you can see there is a grouping of calcifications, a cluster, and there are some here, which is a bit more diffused. So my medical report, it was said, root punctate microcalcifications in the left breast lower inner quadrant. So in a medical term, group punctate basically typically refers to clusters, dot-like microcalcification. So it's been another word for cluster. So if we go back to the wording, cluster, here we go, is intermediate concern. So that kind of marries up with the group for the category 4A, which is requires further examination through a biopsy. And this is my report outcome. So again, I sat at 4A category, which is low suspicion, has low suspicions for cancer of greater than 2% but less than 10, and biopsy is recommended. And then suspicious malignant lesion. So when it comes to a biopsy, it is good news that approximately 9 out of 10 women with a BIRADS 4A will have a benign non-cancerous biopsy. So this has come from the American College of Radiology. So with this so far, I think is pretty good news, I think, for me, having read this, is that it's a low risk. And, you know, even as a biopsy that happens, is 9 out of 10 is non-cancerous. So the odds are pretty good so far. And then here we go, my assessment. So taking my assessment from the imagery, so again, clusters is classified intermediate concern. So it's not benign, sorry, it's not benign, but it's not malignant either. And it's quite small. And it's classified as low risk. And then the ultrasound, which I did have after, came back negative, and also had a palpation done by another doctor, which came back negative as well. So having gained all this information so far, I would say the result of my biopsy is likely to be benign. So that is pretty good news. And for those who's interested in more about like the information I use to do the research, here's a list of references. And I hope people found this useful, and hope this would help those who may be in similar situations, that they can use in order to do their own research to help them understand their bodies more. Okay, thank you.